Hello everyone. Today's video is another Q&A video. Some questions about pandas, questions about ozone treatment for mold, and questions about what to do during a Lyme-related flare. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind, please taking a quick moment to like, share, subscribe, and/or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here was posted on one of my videos about something totally unrelated actually to mold. That's okay. You can post any question on any video. I don't mind. And so it says here, some people have suggested that vitamin C and NAC is good for mold exposure. I was wondering if ozone machines could be helpful if a full remediation is not possible. So thank you for the question. It's a good question. There's actually a book, and I don't remember what the book is called. It would be useful if I could remember at this point, but they're basically talking about like essentially fogging out mold exposed areas with essential oils, actually, like mega doses of essential oils being not vaporized, like diffused into the environment. And, it was very, very interesting. And I've talked to a couple of mold experts about this, and they were like, that's not going to work. That's, not that you just need to do proper remediation and whatnot. But like the information in that book was pretty compelling. Can you achieve the same thing with an ozone generator, like an ozone machine? I don't know definitively. My understanding is that the kind of the industry standard, the general recommendation by the, experts in this area is that like, no, that's maybe going to help to like bide some time until you can have proper remediation done, but that it's really not going to replace proper remediation. Ozone is quite penetrative, but it's not necessarily going to be able to like get to every nook and cranny of where the mold might be. So I'm anyways not an area that I'm an expert in. Like I'm an expert in mold treatment because I've treated many hundreds and hundreds of cases over time. But in terms of like the remediation piece, from what I've heard from different experts, they don't recommend ozone fogging as an alternative to full remediation. That being said, if anybody knows something to the contrary, please post in the comment section below. I'm always happy to learn more. But that's my understanding of it. The next question here was a little bit of a longer one here. So it says here, I'll just cut to the chase here. So it says our son, 5 years old, had antibiotics for a streptococcal infection in September, first for a week, then another 2 weeks after a 1 week break. He had pain when wiping and had ongoing issues with stool marks in his underwear. Our pediatrician gave stool softeners and said it was psychological due to a past constipation episode. After the antibiotics, he started making strange noises randomly, and it still happens today. If you ask him why, he doesn't know. Could this be linked to the streptococcal infection? Should I discuss it with our pediatrician? We thought it was just a phase, but now after learning about pandas, I'm not sure. So yeah, thanks for reaching out on that, and I'm sorry to hear about that. That's really stressful. So again, as per usual, cannot give any advice over social media. What I can say though is that one of the things I think I learned about it from Dr. Jill Krista, who's a mold and pandas expert. But it might have been for someone else. I can't remember. But you can definitely get like a perianal strep infection that can cause irritation and potentially contribute to some bowel related issues, and so they'll actually sometimes in really complex cases of pandas where it's like, okay, we really got to get it like every angle where the strep might be. It's like, yep, you'll do maybe a rapid strep test to make sure there's no acute strep, but then also like do a perianal strep test as well to make sure there's no basically intestinal strep essentially. And so there can definitely be a link there. Seeing strange noises coming up. I mean, I have 3 kids. They've all been 5. They're all older than 5 now. But like 5-year-olds and at older ages, kids are weird. But if it's one of the, we all kind of know what's normal weird for our kids, and then what's like, okay, this is something that's not otherwise explained as by just normal weirdness. So strange noises coming up, and then with the strep link, that's very, very compelling information. I know if it was my child, I would definitely be, well, I would treat them myself because I treat a lot of pandas, but if it were my child and I suddenly forgot how to treat pandas, I would definitely talk to my their pediatrician and see like, okay, what's going on here, or some Lyme literate, pandas literate clinician to get some help in that regard, or to get some further information, because that's all pretty compelling information. So can't really get into any more specifics than that, but if there's any follow-up questions, just post in the comment section below and I'll do my best to answer as soon as I can. The last one here is, so it says, in the case of a Lyme flare, where something like neuropathy manifests that has been gone for over a year, but the patient knows directly they had a series of harsh stressors that brought on the neuropathy again, although they'd rate it less than the original incidence, it's like a stress-induced autoimmune response. Would the wise approach be to go on an immune modulating / cooling herbal supplement protocol, or go back on the attack again with modified cow and herbal protocols that are more antibiotic and immune stimulating in nature? So very good question. I appreciate the wording as well of the question. Yeah, it can really vary in my experience. When there's symptoms that have been in remission for a long time and then symptoms come back up. If in my experience, if the patient has had another exposure, like where like, oh, I got bit by another tick, or some other method where Lyme or whatever the causal agent was, it was like re-exposure or re-inoculation, then the antimicrobial approach in my experience is virtually always the hands down way to go. When it's more of like, okay, it wasn't that, it was more like, different stressors on the system, then usually the immune modulating approach is usually the way to go. But sometimes it's not. Sometimes it's that, the microbes weren't actually fully all killed off. The ones that were left kind of went into dormancy. It's like, oh, the going's getting tough around here. We're just going to hunker down and, hope for a rainy day, for the patient, that, we can come back out and, multiply and cause issues again. So generally speaking, where like in my practice, what I would probably do with like a similar case, if it seemed like a little bit, it was more like a stressor induced thing that came up, I would probably put my patient, to be honest, like on the antimicrobials just for good measure, because I just don't want to miss something important like that. And then if we had previously been working with some immunomodulating support, like low-dose immunotherapy, or specific immunomodulating herbs, or things like quercetin or NAC, or medicinal mushrooms, or whatever it was that we were working with, then I would probably put them back on those two. So I probably do both, because I've seen it go both ways. But because it's gone both ways, and because it can be really stressful and one is having relapse symptoms, then I would probably just hit it hard from both angles. But again, like I would be looking at the specific history of that patient, and if I saw like, oh, LDI, like low-dose immunotherapy, made a big difference for them, then I would probably have quite a bit of confidence that we could get them back on track with that again. But I might throw in the herbs just for good measure. But if they had achieved remission without needing to go on immunomodulators, I'd probably just put them back on the antimicrobials again. But again, it's kind of nuanced. So anyways, kind of a generalized answer, but that's the best one I got for right now. If there's more specific follow-ups, just post in the comment section below and I'll do my best to get to that as soon as I can. I hope that this was of interest today. Any questions, post them below and I'll do my best to get to them as soon as I can, as I've said for like the third time today.